Hello, my name is Carl Barnett. I'm a certified athletic trainer and orthopedic coordinator with Saint Alphonsus Health Systems, and I want to talk today about properly fitting a helmet so that we can help ensure proper equipment fitting and help reduce the incidence of concussions. Coaches are usually over-inundated come beginning of the season and getting equipment out and athletes on the field, and it's hard to make sure that the helmet is fit properly. There is a break-in period, but we want to make sure that it's fit properly before we start actual collision activities. So before I fit the helmet, I want to look at the helmet and make sure it's up to date and to standard. On the back of the helmet is a warning label. That warning label has to be in place. If the warning label is not in place, then it's not a certified helmet and they can actually be penalized or removed from play. And at the same time I look at the warning label, I ask the athlete if they've ever read the warning label. If they have not, I would ask them to read it at that time. It doesn't include pertinent information that they need to know about when they use this helmet. So also on the back of the helmet should be a reconditioning sticker from the manufacturer. It states the date that the helmet was initially issued and used in play, and every year that the sticker or the helmet is used, the sticker needs to be updated. If it is not accurate or if it's not correct, then it needs to be removed from play and it needs to be removed from the athlete. So after you look at the stickers and make sure that the helmet's updated, I want to look at the pliability of the plastic. There's supposed to be some movement in the plastic, but it's not supposed to make odd noises or the paint's not supposed to chip off it. Also, you want to make sure that you're not painting this at home. The manufacturer needs to paint this or dye this. If you add paint to this or you do something different, you could cause the chemical breakdown of the plastic to break down and not be as sturdy for you as you need. So the earpieces are supposed to move in a little bit to give it some pliability, so you want to look at those, and when you do that you want to listen for odd or abnormal sounds and make sure you don't have any of those. Next, you want to look at the face mask and the clips. You want to make sure that the clips and the face mask clips and screws are new. Worst case scenario on the field, I would have to remove the clips and the face mask to establish an airway for an athlete that's had a traumatic injury. If at that time those clips are going to strip or the screws are going to strip, it's going to make that process a lot harder. So I recommend that you change these every year, update these every year, and adjust the screws every week and make sure that those are tight, preferably not on game day. So before game day, look at the screws and clips and make sure those are updated as well. Also look at the snaps for the chin strap. The chin strap goes through a lot of stress, so you want to make sure each snap is adjusted and tight and where it needs to be so that the chin strap itself can be tightened and offer a fulcrum or lever arm for the chin strap to be tightened down to. After you look at the buckles and the chin strap and the face mask, you also want to look at the padding on the inside of the helmet. Most pads today use an air type bladder to help adjust minutely between different athletes. You want to make sure that there's some air before you start the fitting process. It's not too full or not too deflated, and you want to make sure that each bladder itself holds air or does not leak. You also want to make sure the padding is aligned and adjusted in the helmet where it's supposed to be so that it's not falling off or it's not compromised or cause a comfort level with the patient or the athlete when you put it on. Also, the air bladders need to line up on the outside of the helmet so you can put air in the helmet as needed. So if those air holes don't line up, it's going to be much more difficult and it's not fitted properly. So make sure those air holes line up with the outside exterior access points so you can get air into the helmet when the athlete needs it. Once you're happy with the helmet and you're ready to issue it to the athlete, you want to make sure that they can properly put it on and off. So you go through the fitting process, open the ears, slide it over your head. Don't just push it down over your head, and then try to align it as best as possible. Pre-align the chin strap so that when you actually put it on, it's easier to go through that process. So go ahead and put the helmet on for me, sir. You want to make sure they pull it all the way down through the ear holes. When it comes all the way down, that it fits over the crown, it fits throughout the helmet, and it fits throughout the side. Below the eyebrow, you want to be able to put 2 finger widths before the bridge of the nose, which is equal to 1 inch. So if your finger widths are different than 1 inch, find a different way to measure that or look at that. You want to make sure it's not coming down over the nose, it's not sitting too far low. You want to be able to see the eyebrows and be able to measure that 2 inches. You can't have it sit too far forward, you can't have it sit too far back. Just like everything else, you want it right in the middle because it has to go through the crown of the head and cradle the back of the skull and the occipital lobe. So now after you're satisfied with that, you want to look at the auditory canals. You want to make sure that the ear holes actually line up with the auditory canal of the ear so that they can hear and also see and be able to visually see that, or if not, palpate that. And then you want to pre-adjust the chin strap before you get started. Again, if the chin strap is the way for the helmet's designed, it needs to be underneath the face mask, not over the face mask. And it needs to be able to sit in different grooves if there is grooves. This one doesn't have it. So you want to adjust it from the chin strap first, and then pre-adjust it, and then have the athlete be able to snap it from there. So you want it tight, but not to where they can't breathe. They should still be able to open their mouth. They should be able to push out their jawbone back and forth, and it still should be somewhat comfortable. Again, if the chin strap's too tight, it's going to pull down. If it's too loose, you're going to be allowed to move it. The chin strap offers comfort in the fact that it pulls the helmet back on the back of the cranium and keeps the helmet together. So again, you can dissipate the forces over a greater area and keep the brain from trying to shift as best as possible. After you're happy with the chin strap, you want to look at the fitting. Ideally, you should be able to move and resist rotation and flexion and extension of the head without the helmet moving on the helmet or the head itself. So if I resist rotation to the left, rotation to the right, the helmet should not move. The helmet should stay on the forehead, on the brow, and it should be fitted properly so it does not do that. Also, when I resist flexion and I resist extension, the helmet should not shift, should not move, and the chin strap should not come off the jaw. So what I want you to do is stand up tall for me, and I'm going to try and turn your head to the right. Don't let me do it. So again, the helmet stays put, the face stays put, and the helmet does not shift or ride over. And a properly fitted helmet will rotate all the way around, and there's no resistance and there's no support in that as well. I'm going to rotate your head to the left. Don't let me do it. All right, I'm going to go back. Don't let me do it. And now I'm going to go down. Don't let me go down. So there should be some movement in those four directions, but the helmet should not shift, it should not rotate, it should not come off that. You should see the crown pad stick on the forehead and stay connected with the forehead as it goes different directions. We at Saint Alphonsus want to try and prevent injuries. We want to try to prevent concussions. Everybody in the process can help. So if you could help us prevent injuries and concussions, the athlete can be healthier and healthier. Thank you very much.